Hello there. Today is April 7th. We are in the middle of a pandemic. Um, I believe New York had its first death from the coronavirus, aka COVID 19, on March 14th. And so it's less than a month, and so far they've had 4,000, as of today, they have had 4,758 deaths that are due to complications related to this COVID 19, aka coronavirus. And many thousands that are infected and were able to be discharged from the hospital um, without any serious complication that would lead to death. But I kind of wanted to talk a little bit about some data that they released today. Okay, they were being pressured to release data as to age groups and sex and ethnic groups that are most affected. There's a lot of talk about the that African Americans, the people that are brown and black skinned, are in the highest group, but so far they have not disclosed that data, so I can't speak to that just yet. What I'd like to speak to is the data that they have released, and this is what I read today regarding the data that's been released by the state of New York. It's that of the 4,758 persons that have lost their lives due to the coronavirus, 86% of these persons had underlying chronic health conditions and such as hypertension, diabetes, high cholesterol, kidney disease, coronary artery disease, and dementia. I had heard that before, and there was a lot of many people I spoke to did not agree. They did not believe that the truth was being told. But it made sense to me from the beginning, personally, because if one has these health conditions, usually the immune system is not so strong, and so it's so much easier for one to succumb to any major insult to the body like this coronavirus, or even for that matter a really bad influenza. um, the data also says that 55% of those who died from this coronavirus had a history of high blood pressure, and 37% had history of diabetes, and of course, as I said, hyperlipidemia, coronary artery disease, dementia, and kidney disorder were the other pre-existing or underlying condition. Now, I know from my experience working as a registered nurse for well over 20 years, okay, that um, my sickest patients uh, are and were black and brown skinned people. Now, I am black, so I'm not being racist at all. But I find that it's just one of those things that I noticed that blacks and Latinos were my sickest patients. They also usually are my heaviest patients. They are oftentimes overweight, oftentimes obese, even morbidly obese, and oftentimes did not eat healthy, and oftentimes did not have an exercise regimen. These are facts. This is based on my experience. Like I said, I'm black, so I'm not being racist. It's just a fact of the matter. Also, when I go to my gym, the people I see there generally are not people that look like me. Okay, so as a Black woman, it is time that we take our own health in our hands. Okay, we are what we eat. Our diet is very, very important. We need to eat a primarily plant-based diet, fruits, vegetables, nuts, seeds, grains, and in moderate proportion. We need to exercise. Walking is man's best medicine. Okay, so if we're walking I would say 4 days a week for at least half an hour each day, that will definitely make a significant difference with our health. Okay, but what we eat and the exercise, very vital. Also, we need to make sure that we get adequate sleep and decrease our stress level. The thing is that the authorities, the government, and oftentimes the physicians and the healthcare industry, they're not telling us these things because, of course, the healthcare industry, they want you sick. They want you sick because that's how the hospitals and the doctors and the clinics and the diagnostic centers, that's how they make money from our illness. So we need to just get to the point where we say enough is enough. I need to take my health back in my own hands. And the first thing that we need to do as human beings, as part of humanity, as people of color, is to start eating healthy. Cut out the junk, okay? And cut back or cut out meat completely. We don't need chicken, we don't need pork, we don't need beef, we don't need fish. We definitely don't need milk and cheese and those things. They inflame our body and lead to disease conditions. Okay, we were intended to eat fruits, God food, live food, fruits, vegetables, nuts, seeds, and grains in moderate proportion and moderate exercise, and take charge of our own health. Because if we don't, no one will. When we have high blood pressure, diabetes, coronary artery disease, high cholesterol, kidney disease, and dementia, like they mentioned, these conditions predispose us to all kind of illnesses, not just COVID-19. Okay, and because we're getting older doesn't mean that we have to have health issues. It doesn't mean that high blood pressure is normal. We can grow old and die from old age without being hypertensive or having diabetes and heart disease and all those other chronic illness. Let's take our health back in our own hands. Okay, because highly likely that this infection would not be as ravishing as it is if we were as a society in better health. It's all about having rock solid immune system in order to fight this thing and overcome it, because it's very difficult, so only the strong will survive. Okay, the data also showed that 61% of the persons who've lost their lives are men or were men. Okay, men have a tendency of not taking care of themselves, and men tend to, generally speaking, smoke more than women and not eat healthy. Many men, when they're out working so hard, they grab junk, to eat rather than grabbing an apple or some grapes or some fruits or a salad. They will eat the burgers and those junk. But guys, you got to take charge of your health. Okay, this is your body. And if you don't take care of it, who will? So this is a learning opportunity for us. And I'm hoping that this coronavirus pandemic will force us to think, force us to evaluate our health, and force us to make some serious, tough decisions and take back what rightfully belongs to us, which is excellent health, so we can live a long, healthy, vibrant, and energetic life. I was actually in New York when the pandemic became really bad. I have a grandbaby that was born March 9th, and I was there. I intended to be with the parents for a month so I could help them, but when things started really getting out of hand, we decided to leave. So we cut our visit short. And on my way back home from New York, I actually did start feeling sick, severe headache. I didn't have much energy, congestion in my head. I had a little bit of shortness of breath, and my muscles were very painful. And at that time, I didn't even think that I might have had this thing. I thought that it was my allergies that were acting up because I was heading to the south and many of the trees were in blossom, etc. But I don't know. It could have been that I was infected. I don't know. But what I decided to do, because while I was in New York, I really wasn't eating the best. I was with family. So when I'm with family, I tend not to be too picky about what I eat. I just kind of go with the flow. And so I did end up eating more sardines than I normally would, and meat, and eating also more, even the healthy foods I ate more of it. I found myself having rice more often. So my body could have been a little bit toxic. So what I decided to do as soon as I got home was to go on a liquid fast. And so for 3 days, all I had was water and Pellegrino mineral water and herbal teas. And that's what I did for 3 days. So I could detox myself and get rid of, the virus, if it was there, whatever had inflamed my body, and also the junk food and those foods that I normally don't eat, to kind of help my body to rid itself of any insult that these things might have caused. And so for 3 days, like I said, I drank clear liquids, water, mineral water, and um, and herbal teas. I also got a lot of sunlight. It's spring now, so we have a lot of sun, and I would take walks in the sun. And we have a lot of trees in our yard, so walks in our backyard with the trees, the fresh air and sun, and I would rest in between. And after 3 days, I felt like brand spanking new. Okay, so sometimes we also need to fast. You can go on a fruit fast or just eat fruits to help the body to detox. Fruit fast is very effective. And I chose to do just a clear liquid water and herbal tea fast, and I was able to detox really fast, and I feel really good right now. But remember, our food is our medicine, and our medicine is our food. So said Hippocrates, who is called the father of medicine. We are what we eat. So let's learn from all of this and take back our health. Get rid of any junk food in your diet and try to eliminate meats and flesh. No milk, no cheese, nothing of the sort. And if you cannot get rid of it completely, try to cut back on it significantly. You will see a difference in your health. And I don't believe you'll be one of them with underlying health conditions of hypertension, diabetes, heart disease, coronary artery disease, hyperlipidemia, dementia, and kidney disease. If you eat well, exercise, get good sleep, decrease your stress level, moderate exercise, and learn to meditate and relax your mind. Okay? Because what's life without health? All right? Take care and God bless you till we meet again.